All right, we have lesson number 23 here, medical emergencies. First, we're going to start with a scenario in which you are the emergency medical responder. You are the emergency medical responder, EMR, responding to a scene on a downtown street involving a male who appears to be about 60 years old. He is confused and appears agitated. Several bystanders state that they saw the man wandering aimlessly and that he appeared to be lost. Upon interviewing the patient, all you can learn is that his name is Earl. He does not seem to know where he is or where he is going. During your physical exam, you note that the patient is sweating profusely, but other than his diminished level of consciousness, his vital signs are normal. More advanced medical personnel have been called. As an EMR, you want to provide proper care for the patient, okay? So this is a scenario that we're going to discuss in person when we're doing our skill demonstrations. Okay, so now here we have general medical complaints. The assessment and care of general medical complaints follow the same general guidelines. Scene size up. Size up the scene to ensure your own safety and the safety of others. Form a general impression of the patient as you approach to determine if there are any obvious life-threatening conditions such as severe life-threatening bleeding and if the patient appears to be conscious or unconscious. Perform a primary assessment to identify and correct any immediate life-threatening conditions. Conduct a sample history and secondary assessment to gather additional information whenever possible. Obtain vital signs. Summon more advanced medical personnel. Help the patient rest comfortably. Keep the patient from getting chilled or overheated. Provide reassurance. Prevent farther harm. Administer supplemental oxygen if it is indicated based on local protocols. So next is altered mental status. Sudden or gradual change in a person's level of consciousness. Drowsiness or confusion. Partial or complete loss of consciousness. Okay, so this is causes of altered mental status in adults, right? Fever or infection, poisoning or overdose, blood sugar, endocrine problems, head injury, inadequate oxygenation or ventilation, seizures, conditions leading to decreased blood flow or oxygen to the brain, cardiac or diabetic emergencies, shock, stroke, behavioral illness. So those are things that can causes of altered mental status in adults. Next, cause of altered mental status in children. Respiratory failure, hypoxemia, shock, hypoglycemia, brain injury, seizures, poisoning or intentional overdose, sepsis, meningitis, hypothermia or hypothermia. Now, here is providing care for altered mental status, right? Conduct primary and secondary assessments and sample history. Perform ongoing assessments. Ensure an open airway. Place an unresponsive patient in a recovery position if there is no suspected head, neck, spinal, hip, or pelvic injury. Do not give the patient anything to eat or drink. Okay, let's discuss syncope. Sometimes altered mental status is caused by a temporary reduction of blood flow to the brain, such as occurs when blood collects or pools in the legs and lower body. When the brain is suddenly deprived of its normal blood flow, it momentarily shuts down. This condition is called fainting or syncope. Syncope, when the brain is suddenly deprived of its normal blood flow and momentarily shuts down, can be triggered by emotional shock, pain, standing for a long period of time, or overexertion. May happen without warning. Often resolves itself when the person lies down. Can result in a fall that could injure the patient. EMR may not be able to determine the cause. Indicates the need for more advanced medical care and for activation of EMS system. Seizures. When the normal functions of the brain are disrupted by injury, disease, fever, infection, metabolic disturbances, or conditions causing a decreased oxygen level, a seizure may occur. The seizure is a result of abnormal electrical activity in the brain and causes temporary involuntary changes in body movement, function, sensation, awareness, or behavior. A disorder in the brain's electrical activity, sometimes marked by a loss of consciousness and often uncontrollable muscle movement, also called a convulsion. Types of seizures. You have general, tonic, clonic, grand mal, or partial, simple, complex, absence, petit mal, febrile, okay? So generalized tonic, clonic seizures, also grand mal seizures, are the most well-known type of seizure. They involve both hemispheres halves of the brain and usually result in loss of consciousness. The seizure activity is known as tonic-clonic, which refers to the initial rigidity tonic phase followed by rhythmic muscle contractions, clonic phase, or convulsions. This type of seizure rarely lasts more than a few minutes. Okay. Now let's talk about absence. Individuals may also experience an absence seizure, also known as petit mal seizure. These are most common in children. During an absence seizure, there is a brief sudden loss of awareness or consciousness or conscious activity. There may be minimal or no movement, and the person may appear to have a blank stare. Most often, these seizures last only a few seconds. All right. Now let's go to febrile seizures. Young children and infants may be at risk for febrile seizures, which are seizures brought on by a rapid increase in body temperature. They are most common in children under the age of 5. Febrile seizures are often caused by ear, throat, or digestive system infections and are most likely to occur when a child or infant runs a rectal temperature of 102 degrees. Fahrenheit. An individual experiencing a febrile seizure may experience some or all of the following symptoms: sudden rise in body temperature, change in consciousness, and rhythmic jerking of the head and limbs. Providing care for seizures. Priorities: protecting the patient from injury, managing the airway. Seeing someone have a seizure may be intimidating, but you can easily care for the patient. The patient cannot control any muscular contractions that may occur, and it is important to allow the seizure to run its course, because attempting to stop it or restrain the patient can cause musculoskeletal injuries. Okay? Diabetes. Okay? So you have two major types, type 1 and type 2. Hyperglycemic, glucose too high, insulin or too low. Hypoglycemic, glucose too low, insulin too high. Okay? Diabetes is one of the leading causes of death and disability in the United States today. In 2016, 29 million Americans were living with diabetes and 86 million had pre-diabetes, a serious health condition that increases a person's risk of type 2 diabetes and other chronic diseases. Diabetes contributes to other conditions including blindness, kidney disease, heart disease, periodontal gum disease, stroke, and amputations. So here are signs and symptoms of diabetic emergencies, okay? Changes in level of consciousness, including dizziness, drowsiness, and confusion, irregular breathing, abnormal pulse, rapid or weak, looking and feeling ill, abnormal skin characteristics, okay? Care for diabetic emergencies, okay? Perform a primary assessment and care for life-threatening conditions. Conduct a physical exam and sample history if patient is conscious. Note medical identification tag or bracelet. Conscious patient who is alert and able to swallow. Give them sugar, glucose tablets, fruit juice, table sugar, or a commercial sugar source. That's a conscious patient. Now, an unconscious patient, monitor the patient's condition, prevent them from getting chilled or overheated. Summon more advanced medical personnel and administer supplemental oxygen based on local protocols. All right. So now, talk stroke. A stroke called a cerebrovascular accident is a disruption of blood flow to part of the brain which may cause permanent damage to brain tissue if not properly treated within several hours. Okay? Let's see. All right. Here's some signs and symptoms of a stroke. Looking or feeling ill, weakness or numbness, face, arm, or leg, facial drooping or drooling, speech difficulties, visual disturbances or loss, dizziness, confusion, agitation or loss of consciousness, loss of balance or coordination, incontinence, abnormal behavior, sudden severe headache. Those are signs and symptoms of a stroke. Stroke assessment scales, okay? So, two common stroke assessment scales used in the pre-hospital setting are Cincinnati Pre-Hospital Stroke Scale and the Los Angeles Pre-Hospital Stroke Screen, LAPSS, which assess facial droop, arm drift, and speech. Both scales should be included in your assessment of the stroke patient and reported to the medical facility. Care for a stroke. If the patient is conscious, so this is what you do if the patient is conscious. Monitor the patient's condition. Check for non-life-threatening conditions. Offer comfort and reassurance. Do not give the patient anything by mouth, okay? A lot of times it feels natural to give somebody something by mouth when they are, having a stroke or under stress, but it's not always good for them. If the patient is unresponsive, so this is what we do if the patient is unresponsive that is having a stroke, to care for a stroke. Ensure an open airway, so they can breathe. Care for any life-threatening conditions. Position the patient in a sideline recovering position to allow any fluids to drain out of their mouth. All right, abdominal pain. Abdominal pain is felt between the chest and groin, which is commonly referred to as the stomach region or belly. There are many organs in the abdomen, so when a patient is suffering from abdominal pain, it can originate from any one of them. These include digestive organs such as the inferior end of the esophagus, stomach, small and large intestines, liver, gallbladder, pancreas, aorta, appendix, kidneys, and spleen. Abnormal emergencies can be life-threatening and require immediate care to prevent shock. So, sudden onset is called acute abdomen. Intensity of the pain does not always reflect the seriousness of the condition. So, meaning that you don't have to be in a lot of pain to be in a serious condition with your abdomen. Care. Ensure there is no severe life-threatening bleeding. Ensure an open airway. Call for transport. Watch for signs, potential aspiration due to vomiting. Do not give anything to the patient by mouth. Watch for signs of shock. So if someone's having abdominal pain, don't give them anything by mouth. Gastrointestinal bleeding. Okay. There are multiple causes of gastrointestinal bleeding, and these tend to be classified as either upper or lower. Depending on the location of the problem with the gastrointestinal tract, bleeding in the upper gastrointestinal tract originates in the esophagus, stomach, or duodenum. Okay? So there are multiple causes of gastrointestinal bleeding. A patient with gastrointestinal bleeding may experience vomit of blood, bloody bowel movements, or black tarry stools. Symptoms may occur accompanying the bleeding include fatigue, weakness, abdominal pain, pale appearance, and shortness of breath. Serious gastrointestinal bleeding can have a significant impact on vital signs. Special considerations for dialysis. Patients on dialysis can experience several types of complications. For example, uremia, accumulation of urinary waste products in the blood, fluid overload, reduction in the body's ability to excrete fluid through urine, anemia, hemoglobin deficiency, hypertension, excess potassium in the blood, and coronary artery disease. Emergencies also can occur as complications of dialysis itself, including hypotension, disequilibrium syndrome, hemorrhage, equipment malfunction, etc. Information on past dialysis and complications, current dialysis section, patient's dry weight, amount of fluid removed, recent sodium, potassium and fluid intake, fluid status, mental status, cardiac rhythm and shunt location, and whether active or non-functional, any associated medical problems, evidence of possible hypovolemia or hypervolemia, signs and symptoms of altered mental status, cardiac rhythm. All right, we got a little scenario tossed in here in which you are the emergency medical responder. As you continue monitoring a patient, he becomes even more confused and agitated. You begin to notice signs of shock. What do? This is something we'll discuss. Basic pharmacology, drug names enrichment, chemical, generic, trade or brand. Drug profile. And actions, indications, contraindications, side effects, dose, route, oral, sublingual, inhalation, injection, topical, intravenous, vaginal, rectal. Okay. Drug administration. The 5 rights are the right patient, right medication, right route, right dose, right date. Okay. So this is just an example. You have to have the right dose. You might have someone 300 pounds that needs a different dose of medication than someone 120 pounds. A male might require a different dose as opposed to a female, right? The right medication. Many problems have caused misdiagnosis, someone taking the wrong medications. EMRs are to administer medications only by routes they have been licensed or authorized to administer, and that varies from state to state. Assess the effects. Document reason for administration, drug name, dose, route, and times of administration. Any side effects, how often it is administered, and any improvement or changes. Blood glucose monitoring. Test a drop of blood on a test strip using a glucometer. The normal levels, okay, 90 to 130 milligrams before meals, 180 milligrams after meals. Hypoglycemia plus 70 milligrams. Now, this is how you care for hypoglycemia. If the patient is conscious, provide 15-20 grams of glucose, 4 to 5 glucose tablets depending on the manufacturer. Recheck the blood glucose level after 10 to 15 minutes. If the patient is unconscious or unable to swallow, seek advanced life support immediately, because we're dealing with a more serious problem here. All right, so that concludes lesson 23.